Wilson with the Health Department, and I'll be assisting with roll call today.
Thank you very much, Kelsey. If you could go ahead and get a roll call for our attendees this evening.
Absolutely. Dr. Drake.
I'm here.
Okay, thank you. Dr. Gocher,
Here.
Dr. Hurt,
Here.
Mayor Jacobs,
Here.
Dr. O'Brien, I believe is not here. Ms. Roma,
Here.
Dr. Shamia,
Here.
Dr. Souza,
Here.
Ms. Wagner,
Present.
and Dr. Buchanan.
Here.
All right. All present with the exception of Dr. O'Brien.
And I believe that constitutes a quorum. So we have established a quorum for the meeting. The next item of business is approval of the minutes from the January 13, 2021 meeting. These should have been distributed electronically. And if you have not already done so, take a moment to look over those. And I would ask if there are any additions or corrections. And if there are none that are really outstanding, we can take a motion and a second for approval of the minutes, and then any discussion after that that we need.
Motion to approve.
Second.
We have a motion and a second. Any other discussion on the minutes of the meeting, additions, corrections, substitutions, etc.? Hearing none, Kelsey, could you give us a roll call vote on the approval of the minutes, please?
Absolutely. This is Kelsey Wilson with the Knox County Health Department, doing a roll call for the minutes. Dr. Drake,
Yes.
Dr. Gocher,
Yes.
Dr. Hurt,
Yes.
Mayor Jacobs,
Yes.
Ms. Roma,
Yes.
Dr. Shamia,
Yes.
Dr. Souza,
Yes.
Ms. Wagner,
Yes.
and Dr. Buchanan.
Yes.
All right, passed unanimously.
Very good. So you have approved the minutes for January 13. The next item on the agenda is to set the agenda, and you should have had distributed to you the proposed agenda for this evening. And if there are no outstanding discussion about it, we can go ahead and ask for a motion to approve in a second, and we can discuss it.
Motion to approve. Second.
So we have a motion to approve in a second. Is there any discussion on the agenda items this evening? Additions, corrections, deletions, substitutions? Hearing none, I believe we're ready to vote. Kelsey, if you will give us a roll call on setting the agenda for the meeting this evening, please.
Dr. Gocher, Mayor, Dr. Buchanan had raised her hand.
I'd like to add just an informational item on the community health assessment just before other business.
Okay. And that will be, I guess, new item 10, community assessment. Dr. Buchanan? Mayor Jacobs, did you have an item that you wish to add to the agenda?
No, sir, I was calling your attention to Dr. Buchanan.
Okay. So we have that revision that Dr. Buchanan has put in. And so we have a motion and a second, and I believe if that is considered a friendly amendment by the motion and seconding folks, we can go ahead and vote on that. I sense that it is. I see some nods. Okay. So Kelsey, if you'll go through a roll call for us on the agenda for this evening.
Absolutely. Dr. Drake,
Yes. Yes.
Dr. Gocher,
Yes?
Dr. Hurt,
Yes.
Mayor Jacobs,
Yes.
Ms. Roma,
Yes.
Dr. Shamia,
Yes.
Dr. Souza,
Yes.
Ms. Wagner,
Yes.
and Dr. Buchanan.
Yes.
Passed unanimously.
Thank you. So you have set the agenda for our meeting this evening. And the next item on the agenda, which is 6, is the Knox County Health Department's benchmark presentation by Dr. Buchanan. So Dr. Buchanan, if you are ready, we are ready to hear you.
So, okay, so thank you, Dr. Gocher, and thank you, Catherine. For our vaccination update, we have updated our vaccination dashboard on the website, which is what you're looking at now. This provides a countywide look at vaccination data. As of yesterday, when this data was pulled, more than 34,000 vaccinations had been reported in Knox County. That's 7.3% of the population. You can see below those boxes that the breakdown between 1 dose and 2 dose, what the breakdown between first dose and second dose is. These include the vaccines given by public health, hospitals, and pharmacies that are partnered with long-term care facilities. And this data is from the Tennessee Department of Health. Here at KCHD, as of yesterday, we administered more than 6,600 first and second doses. Below those boxes, you can see a demographic breakdown of Knox County vaccination numbers by age, race, ethnicity, and sex. We will update these numbers weekly. All of the data, except for our internal number, is coming from the Tennessee Department of Health. We continue to vaccinate those in first priority groups, including healthcare workers, first responders, and those 75 or older. For a full list of who qualifies, you can scroll down to our vaccine information page to see a list of all of the phases as outlined by the state. As we have mentioned, while KCHD and hospitals are the primary vaccination hubs right now, that will not be the case in the future. We continue to look forward to when the vaccine supply is greater, which will allow more places to administer the vaccine. It's important to remember that right now we are in the initial vaccination phase. Public health is just one part of the larger system, which includes medical providers, hospitals, and pharmacies. In the coming weeks and months, we will continue to transition into a transition phase where other groups are added to this vaccine administration role. This will help to speed the process and increase access to a larger group of individuals. And actually, we the Knox County Health Department, are working with some community partners to allow vaccine to occur in some different places. It's not totally dependent on us having a clinic. So again, some of that is helpful. The hospitals have been helping vaccinate, and for folks who are more comfortable going somewhere else, we're hoping to offer opportunities for vaccination throughout the community and not just the vaccinations that we're doing. In addition to that, that will help free us up a little bit to be able to outreach to some higher risk groups that might not want to go to a large event, or maybe just can't even go to a large event. So a lot of combination of ways to get vaccine out there, I believe, is going to continue to see that percent vaccinated increase, which is encouraging. For now and for the foreseeable future, the demand for this vaccine continues to greatly outpace the supply. We have seen evidence of that during every vaccination opportunity we've announced. We continue to work with the county IT department to roll out a new online registration and scheduling system that will have a wait list option. We have heard the desire for a wait list from our community and are working to make that a reality. That said, it is incredibly important to us to ensure we found a system that can do what we need and do what we needed to do related to the automated scheduling of appointments. Our team has worked incredibly hard and has done a lot of research to find a system that is robust enough to handle the expected volume, while also having features that can be used internally by our clinical team to increase efficiency at appointments. So I'm really grateful to County IT for the work they've put in, and Mayor Jacobs for support of that work and allowing us to hopefully have a really robust system that will be user-friendly and even speed things along in the clinic, which would be nice. We're working through the contractual process right now to begin utilizing the system and hope to have an update later this week. So now we'll move on to the local COVID-19 situation. We have 103 new cases since yesterday, 2,830 active cases. 94 Knox County residents are currently hospitalized. And sadly, we have 9 additional deaths to report today, raising our total to 455. So now we'll look at our benchmarks. So for our first benchmark, sustained reduction or stability in new cases for 14 days. Over the 14-day time period, we saw daily new cases drop to approximately 179 per day, down from the previous reporting period, which was more than 200. We are optimistic about these numbers, but we are continuing to keep a close eye on them. Because of this, we are representing this benchmark as yellow. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. Regarding testing, we have seen it decreased a bit in our community. That's also a trend that we're seeing here at KCHD as well. We are no longer seeing the volume of folks coming to get tested that we were seeing before the holidays. On an average day at the health department, we are currently seeing less than 200 people a day on the days in which we're testing. A few weeks ago, we were seeing more than 400 a day. This is consistent with what we've seen across the community. We are hopeful that this is an indication of lower burden of disease across the community, but we'll continue to keep an eye on it. And we continue to urge anyone who has symptoms or has been exposed to COVID to please get tested. Regarding lab turnaround time, this number has continued to decrease and now sits at an average of 1.5 days for the community. Because of the lower testing numbers, coupled with positive news regarding a shorter lab turnaround time, we are representing this benchmark as a cautious yellow. Our third benchmark, sustained or increased public health capability. We are restructuring this benchmark to better reflect what our public health capability looks like, as the bulk of the response activities have shifted from case investigations and contact tracing to vaccine distribution. We're evaluating how we can best represent our capacity, as our response has evolved. This benchmark needs to as well. While we restructure this benchmark, we are not assigning a traffic light color for this week. Fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. During this time period, we've continued to see hospitalization numbers decrease. This is encouraging. It's something we hope to see continue, but we will continue to monitor these numbers closely as we are still sitting at a high volume. It's just not as high as it was several weeks ago. After speaking with our hospital partners, they are recommending that we represent this benchmark as a stable yellow. Our fifth benchmark, sustained or decreased COVID-related death rate for identified positives and probable cases. During this time period, we have seen 65 deaths associated with COVID-19, which is consistent with what we reported out last week. The information available leads us to continue to represent this benchmark as red. Under our supplemental data section, the first chart shows new daily COVID cases per 100,000 population. As of Wednesday, our 14-day trend line shows 37 new cases per 100,000, and our 7-day trend line shows 32 per 100,000, which is down from last week. The second chart shows the percent positive for COVID-19. This data is received from the Tennessee Department of Health. The 7-day average for percent positive in Knox County is 15.64, which is down from last week as well. For some context, at the beginning of the month, the 7-day average was 23%. And also just for a little bit of context, we continue to see people die from COVID-19, which is unfortunate. We hope those numbers will go down, but we also know that that's a number that's going to lag behind cases and hospitalizations in recovering because of the time frame. People have to get sick and sick enough to go to the hospital and sick enough to pass away, and that takes some time. So we hope to see that turnaround and that change. The numbers are encouraging, but I want to remind all of you and anybody watching, this is not the time to just go, whoop, everything's done. We can go back and stop wearing masks and stop social distancing. Please don't do that now. We're trending in a positive direction. Let's keep going that way. And the only way we can keep going that way is if we all continue to observe the 5 core actions. It's more important now than ever. We have vaccine on the way, slowly but surely getting into our community. So that's encouraging as well. So overall things look good, but we want to keep them going that way. Thank you. Any questions?
Thank you for your report, Dr. Buchanan. Any questions from the board regarding that report?
Dr. Buchanan, just a question about the contact tracing as we look toward the future. I know we've gotten to that point where we had so many cases, it just doesn't make any sense. And then we have the competing priority of obviously vaccine distribution. Knowing that there's discussion about the variants and we don't know whether the UK variant, which I guess what we're hearing is it's more transmissible, maybe not any more lethal. But if these numbers keep going down, would we ever get to a point where it actually makes medical sense to reinstitute contact tracing and investigation, at least back similar to what it was, because we're low enough that it might actually help? Or is that either doesn't make clinical medical sense, or it's just that the competing priority of vaccine distribution, the vaccine will be so much more important that we just won't get back to where we were?
You know, that's a great question. And honestly, one I would really want to just talk to my epidemiology team about. So it's certainly a reasonable question and something that we could consider, although we really do want to focus our attention on vaccinating, as that even with the variants is a very important piece of us, piece of what we're doing.
Other questions, discussion? If not, again, Dr. Buchanan, thank you very much for your report this evening. Next on the agenda is the University of Tennessee's Medical Center Knoxville data update by Dr. Shamia. So Dr. Shamia, if you're ready, we are ready to hear it.
Great, thank you. It'll be a similar story. So next slide, please. So we see the cases by week and month in the county and the district. I'd really focus our eyes on the week to week, and we see how now consistent that decline is. We still, again, context, 1,661 cases is still a lot of cases in a week, but this is too consistent of a trend to not be real. Next slide, please. So not only are we seeing this same trend across the state, but we're seeing the same trend across much of the country. And so that certainly is good news. And for that matter, what everyone was expecting, which was the post-December holiday spike. I mean, we really did seem to get a post-Thanksgiving spike. There was no question in our minds about that, but we didn't see the post-December holiday spike. One thing that we've come to recognize is these super spreader events seem to take longer to manifest in a case, and certainly a hospitalization spike, than we even really thought. But we're still, I mean, we're almost to the end of January at this point. Next slide, please. So just a few interesting observations is that in many of the decades, we're seeing that drop. There's some others that are kind of just more steady. And so for whatever reason, 0 to 10 is just kind of flat. 71 to 80 and 81 and over are kind of flat, whereas these other decades of life seem to be showing that decrease. Next slide, please. Next slide, please. Thank you. So the positivity rate is probably didn't really increase. That most recent data point, that 126, that there was some data that had to catch up, as we've seen at various times. So we do think that's probably real at 23, 24%, but we don't necessarily think that it dropped and came back up. It probably has been just a little bit of a slower drop from that peak of over at well over 30%. We have to remember that we honestly, there's a yellow line at the 10, but as we're on the improving side of this, we want that to be below 5% to feel like that we've got some degree of pandemic control. Next slide, please. So the hospitalizations, this is the one that always seems to lag. So when you see that January on the far right-hand side, those big numbers, that some of that was without question a catch up from December. And so I think the next slide, the census, tells us a better story. So next slide, please. And so here you see just what a significant decrease that we've had since that spike we had at 615. And so that has been steady. We see it on our capacity call that we do across the community still every day. And we've certainly seen it at our own facility. And this is what led to that yellow benchmark. And so some of the restrictions that have been placed on non-essential procedure scheduling, again, each system is reacting to their own situation, but some of those things have been relaxed, and we continue to look at those things. Now, again, 352 patients. We were at one point there in October at 236, and we had a lot of respect for that number. And so, as Dr. Buchanan said, we don't want to just get complacent about 352, but the trend is certainly in the right direction. Next slide, please. So again, I always make kind of comments on this about take this for what it's worth. I think we all do. None of us would think it's realistic that those trend lines would get us all the way down to zero in the same way that when it was headed into very, very high numbers, it didn't seem realistic as well. But what it really shows is simply it drives home how steady the decline has been over the last few weeks. And so we would expect there to be some degree of that to continue. And if we do see another spike, and I think it's entirely possible that we will, we should see it coming, at least to some extent. I think that's the last slide. So just wrap up comments. I would echo what Dr. Buchanan said on the mortality side. We still have continued to experience that and feel that, and our care teams feel that very much when we have a 24-hour period where we may have had at our facility multiple mortalities, but it would stand to reason that as she said, those are patients who were sick, admitted, maybe had a prolonged hospital course, and so we hope that will drop in the near future. And so, Dr. Gosher, I think that completes my report. I'll be happy to answer any questions.
Thank you, Dr. Shamia. I guess I had a question to either you or Dr. Buchanan or members of the board. Is there any biologic or epidemiologic reason for the decreases that we've seen nationally? I don't think it could be vaccination at this point. It's too soon.
I'm willing to take Dr. Buchanan, do you want to go first, and then you're probably more the expert, or do you want me to try it?
Go ahead and try.
Well, I mean, we've had that conversation quite a bit internally because, this is not, to be quite frank, we felt like we had gotten pretty good at predicting where this was headed. And I think we had, and this has been, I think, not just locally, but nationally, the lack of the spike really, and not only that, but the fact that it has gone down is not what many people expected to see. So here locally, I do think that the snow right around Christmas probably helped us. Now, if it had only been Knoxville that missed the post-Christmas spike, then you could really blame the snow. But the fact is that a lot of people didn't see it. So I'm not willing to put too much stock in that. Another thing that I think is that we now have not just a decent number of people who've had COVID, but there are quite a few people now who know in some way, shape, or form it's affected their sphere and their life they know someone or know of someone who has either been hospitalized or died of COVID. And I do think that started to drive it home and probably had some impact for at least a period of time on people's behavior and in terms of how the precautions that they took. There are other theories, but those are my two to start with. Dr. Buchanan, what do you have?
No, that's what I was going to say, that really I think that we have reached a point where enough people know somebody who's been seriously ill or passed away from COVID that it's actually impacting behavioral change, that people are embracing the 5 core actions more readily, and we're seeing that impact. I think, we also have seen a high number of cases. So we have some people who have some immunity, which can help to slow transmission as well. We certainly don't have enough people with immunity to really make such a big change in the continued trends, but it's certainly impacting as well. And there's not a vaccine out there for it to have a role. So I think what I would say to our community is keep up the 5 core actions and be even more diligent than you have been, so we can continue to see these positive numbers. I don't disagree that we might have another spike. Hopefully it won't be as large as our post-Thanksgiving spike was. I know that Knox County Schools has several schools on virtual at this point, I think. Lisa, how many?
I think it's about 4.
And UT, I think, is seeing some increase in cases with students coming back as well. So we have both of those things happening, which in the past have impacted our community case rates. So we'll have to be diligent and watch that.
Any other comments on Dr. Shamia's report? Questions? If not, again, thanks very much for a thorough report, Dr. Shamia. Next item on the agenda are questions for our educational institutions. And we have previously submitted one from Knox County as well, Knox County Schools, as well as the University of Tennessee. And this evening, I noticed Dr. Gregg is on the line. Dr. Gregg, did you have any comments or discussion about the data from the University of Tennessee?
It's good to be back with you guys. We appreciate you inviting us to join you again tonight. The information that we provided, we're just on the front end now. Students have been back a little less than 2 weeks. And we're, as you had said, we expect to see an increase in their number of active cases that are here on campus. But we are pleased that what we've seen during this time doesn't appear to be as steep a spike as what we saw back early in the fall semester to this point. So that's reassuring. Our saliva testing started this past week. I don't have any hard numbers for you this evening in regard to that, but the numbers that we are tentatively seeing from just the first 3 days of testing through our saliva testing process is quite good at around 0.4% positivity rate for our on-campus housing facilities. So we don't have a full week's worth of information there. So as we get more of that, then we'll be able to really feel better about where we are in that regard. I would also like to point out that this semester we have opened our community saliva testing to our commuter students. And so we are encouraging them to participate as well to give us even more accurate numbers for our campus community.
Thanks, Dr. Gregg. Any questions from the board to Dr. Gregg this evening about the University of Tennessee's information?
Dr. Gregg, I have one question. Your saliva testing, and you and I've had this conversation, I just can't remember. Are those numbers reported to the Department of Health? Not to us, but you.
Well, we're just reporting them through our regular updates that we do to the public here, because that pooled saliva testing is not being done for diagnostic purposes, it's surveillance purposes. But if someone in a positive pool ultimately tests positive, then that does get reported to the Knox County Health Department.
Okay, thanks.
Any other discussion on the University of Tennessee's data? If not, again, Dr. Rigg, thank you very much for your report this evening. Thanks for sharing your time with us. Ms. Wagner, any information that you would like to share or go over with us regarding Knox County schools?
No, we did send out a survey to all the teachers just to determine the interest of the COVID vaccine. I'm not sure of the results of the survey yet, but we did send that out.
Thank you. Questions? Questions for Ms. Wagner from the board about the Knox County School report?
I don't have a question. I do just have a quick comment though, for Lisa and anyone else on the board or folks that are watching. There was an interesting study that came out in MMWR yesterday. Not sure if any of you saw the news blips on it, but they looked at, I think it was 17 schools, I believe 1st through 8th grade, I think in Wisconsin. And it sounded like they were doing very similar types of measures that we're doing here in Knox County. And there was a very, very low rate of transmission actually in the schools with the students. I forget, it was maybe like 7 students across all the 16 schools. And then I don't think there was actually any intra-school transmission for the teachers or other staff. So just something to look up and compare how it is what we're doing with our school system.
Any other discussion or questions? If not, thanks for the report from Knox County Schools. And next up on our agenda is our review and discussion section. And this is going to start with 2020-1, our face covering regulation, which dates back to July 1st of 2020. And as you all know, this is a continuing regulation, which is not being sunsetted. So it still will remain in force. Any discussion about 2020-1, usually at this point, I may ask Dr. Buchanan if she's had any input to the Knox County Health Department regarding 2020-1, or Mayor Jacobs, if you've had any feedback, negative or positive, on 2020-1 in the last couple of weeks.
I have not been alerted to any changes in concerns or complaints about 2020-1.
Same here.
Okay, thank you all. Any other discussion on 2020-1 from board members? If not, we'll go on to 2020-7, which is our restaurant occupancy limitation early closure. It expires on February the 4th. And I believe, if my math is correct, it will expire before our next meeting. So we would need to, if we want to continue that, act on that this evening. Any discussion about 2020-7? So one point of just general discussion, I think Dr. Shamia has talked with the board about this maybe several weeks ago at this point, and it was that we were wanting to look for, you know, a switch, a trip that would tell us it's time to maybe discontinue or modify regulations. And I think we looked at a positivity rate, if I remember correctly, of 5%. We are, I think our last positivity rate was about 13%. So we're still above that. So if we're being guided by those figures, I think we would probably need to continue this until the next time that we meet. Any general discussion about that? Anybody offering a motion or second to continue that regulation?
I just wanted to clarify the number with Dr. Buchanan, because I know sometimes her numbers and mine don't line up, but are we at a 13%, Dr. Buchanan, or are we still higher than that? My data had us higher than that.
So I believe our current benchmark has us at 15%. Is that right?
Okay.
16 or 15?
15.61.
So, yeah, we're still at 15, a little more than 15% positivity rate.
Okay. So any more discussion, thoughts about that?
So I guess I would like to maybe just open it for discussion. So I'll make a motion to extend it without stating exactly when until we can discuss it.
Okay, fair enough. Do we have a second to that motion?
Second.
So we're open for discussion, and this is, as I understand it, Dr. Sousa, a motion to indefinitely extend?
No, that wasn't what I was saying. I guess I didn't want to commit to any particular date without actually discussing. It's always hard to make a motion before you have a discussion
You'll
with the
accept a
group.
friendly amendment, I would assume.
Yeah, so for extension until to be determined based on discussion.
Okay.
And I guess, as I'm thinking about this, our numbers are looking better. We're seeing a trend in the right direction. Do I want to completely take it away? I don't know that I do, but is there an option for possibly going back to that later curfew that we had earlier, like 11 o'clock? So I believe we're at 10 right now. Just up for discussion.
Well, and I'm like-minded in general on that, in that again, if we get too confident in terms of the trend, it won't take much to cause us to lose that and it go in the other direction. I do also think that there is a broader message that at least for those who do pay attention, that sends as far as where our head is in terms of the status of the pandemic. I would be absolutely receptive to loosening some of the restriction. I personally would favor doing something along those lines as opposed to not renewing it entirely.
Other thoughts or discussion? Personal discussion from my standpoint, I agree with you, Dr. Chimia. I think that for responsible business owners, this would probably help them somewhat in trying to get through this economically. And I don't know that it would make any significant difference. We could watch it, of course, very carefully to make sure that assumption is true.
So, Dr. Gocher, are you saying that in terms of not renewing it or renewing it with
renewing it with extended times?
Extended times.
Yeah.
And I don't know if, does it make sense? Does 11 make sense? Is midnight too late? I don't know that there's any science either way. And I don't know if Dr. Buchanan, you've got any information that can help with that. I know that we had this discussion a long time ago about, does 10 o'clock make sense? Does 11 o'clock make sense? And the short answer is we're not sure.
Yeah, I mean, the last thing that I heard from when Dr. Burks was here, what they looked at was closure at 10 or 11. They did not look at closure later than that. I think essentially, I could be wrong, but for the majority of businesses, closure at midnight is probably not a restriction at all.
Mayor Jacobs, I'd like your thoughts on this. My impression is that it would help our businesses. Would that be your impression as well?
Yeah, I think if you were to, again, I think most restaurants close at 11 on weekends in any case. So as far as the restaurants that serve alcohol, this would essentially take any impact off of them. I think a lot of them close at 10 throughout the week, and then some close at 11 on weekends. So I think it'd certainly be helpful to move it to 11.
Is there any advantages to those businesses in closing at midnight?
Yes, I've also been, we had a specific email. It was about 3 days ago, maybe 4, from a business on the Strip, and I went ahead and called that particular owner, and he explained to me that not only of course, for every hour makes a big difference to the bottom line. But in addition to that, especially when there are games on this time, that extra time, just being able to stay open, even 30 minutes. There was a 30 minutes left of an important game very recently that would have made a huge difference as well. So if there's not a huge impact in terms of risking more spread, in terms of an hour or two, that extra hour or two can really make a big difference to the businesses.
So I would just say that the behaviors that we see around watching sports in a restaurant, because you don't sit at your table and watch sports in a restaurant, are the very behaviors that spread COVID. You gather around the bar in groups and eat and drink, and those are the behaviors that spread COVID. So I think we have to be cautious about opening too quickly and opening too much.
I agree. And there's other options too. There's, in other areas of the country, what they've done is there's no bar service. If folks are in a restaurant or bar, they have to be seated at a table and the bar is closed altogether. I'm not suggesting that. I'm just saying there are other options. I mentioned last week that what I would like to see is just more, maybe just have a discussion about having a more consistent regulation that's more countywide instead of just to this specific industry. But that's why I'm still having a hard time with this, is because this is just restaurants, and I think it's contributing to a little bit of confusion and non-adherence because of that. And so what I'm saying is, I agree with you, Dr. Buchanan. I mean, certainly I've been in the bar scene. I have experience working in the industry. I know that you're right. And I don't know what the answer is. I just wanted to communicate that I think that an extra hour or two might go a long way, and it's possible that it wouldn't make a huge impact on community numbers. I'm not the public health expert, but it's possible.
Well, I think a general concept should be that when you're in trouble, you close down fast and you open up slow. And so, whatever we do this week, if we give it a 2-week time, if we give an hour this week, and then if we're continuing on this trend, we give another hour the next week, that would be one way to kind of balance some of these issues. Because if it starts going in the wrong direction, we have to just revisit it.
Do any of the board members have any information in other communities, either in Tennessee or elsewise, if regulations have been sort of ratcheted up and ratcheted back down, and how that's accepted by the businesses or how it's accepted by the public? I think we discussed it maybe briefly before, that it really could create confusion and maybe you have people disillusioned, but I don't know if there's any hard information on that. And I didn't know if anybody had information or anything they had read about other communities where things were going up and down in terms of regulations, and it was either confusing or difficult for the businesses to follow. Any information that anybody has on that that's solid?
So, Dr. Gocher, I have a little bit. I kind of looked at that today specifically for that reason. And so I think as a broad statement, and again, every city does their own thing as far as how they restrict and how they approach, but Shelby and Davidson really I would say at this particular moment would still have somewhat more stringent restrictions than us. Hamilton has, the best I could tell, face mask ordinance and not a lot else right now. And so, but to be able to say that I went, Shelby, for example, I think has a 10 p.m. Closure, and then you may remain till 10:30 type of situation. And I don't know the time or whether Davidson has a time associated with theirs. So they're still there, I guess, is the point, but they may not be identical to what we have in place right now.
Yeah, they're not. I was on a call last week or this week, I think, anyway, recently, with the health director from Nashville was on the call, and their regulations are very complicated. He was kind of rambling off all the things that they have in place and what they're looking at relaxing. And I mean, this regulation and the regulations we have, I believe, are pretty straightforward, and so and limited in nature. So I'm not sure what else we could do to make it more clear, or if there is an industry that there's evidence of spread in other industries, what the recommendations would be regarding that.
So if we're not having a whole lot more discussion, I guess I would make a motion to extend it another 2 weeks, but change it from a 10 p.m. to an 11 p.m. And then we could revisit again, as Dr. Shamiya said, in 2 weeks. And if we're doing the right direction, then keep making it later.
So Dr. Sousa has made a motion. Do we have a second?
Second.
So we have a motion and a second. Further discussion on how we're going to maybe reconfigure slightly 2020-7.
Just a clarification that we are currently at, I just want to confirm, we are at 10 right now. Okay.
Other discussion from board members? Any thoughts on it? Personally, I think it's a reasonable approach. I think we would all like this to end, but I agree with you, Dr. Shamiya. Once a steep curve starts, it's very slow to go down, and we have to respond, appropriately as it's going down.
Dr. Sousa, can you confirm, when you say 2 weeks, do you mean 2 weeks from the 4th when it expires?
Yes, that's what I was thinking, so that we would at least be able to discuss it before it expires again.
That would be the 18th?
Yes.
Okay, thank you.
Because I think we meet again on the, I can't remember which date it is.
We meet again on the 10th.
Okay, so that would give us plenty of time.
Okay. Any other discussion? I have a administrative point. If we change this, is this still considered 2020-7, or do we renumber it? Maybe Mr. Sanders can help us with that burning question there.
Sorry, I had to find my unmute button there. I think you can keep the same number for the regulation and just amend it to be the 2020, be to the new time. I don't think you need a new number just because you changed the time on it, but just make clear that you are in fact changing the time. And for that, you probably need to print out. Well, now I'm talking myself out of it. Yeah, why don't you give it a new number? Because at that point, you're going to have to print out a new one and have it in writing for people to be able to follow it. It would be cleaner to be able to have a different regulation that is printed and has the new number on it. So I would suggest that Dr. Sousa amend her motion to allow 2020-7 to lapse and introduce a new regulation with the same provisions except for the change in time.
And Mr. Sanders, that number would be 2020-9. Would that be correct?
I'm not sure. I don't keep track of the numbers particularly. Okay. But whatever it is, the next continuous number, whatever that is.
Whatever is appropriate. Thank you. Further discussion on 2020-9, I think. I think it's going to be 2029.
Would that not be 2021 dash 9?
2021, that's absolutely correct. Yeah. Will we start over at 1, Mr. Sanders?
I believe you would. I mean, that's entirely up to you as to what number convention you want to use. But typically, since it appears you started with regulations based on their year, that would make the most logical sense.
That's what we'll call it then. Dr. Sousa, is that okay with you?
Do I have to repeat the motion
No,
and get all that right?
Renumbered it. We just renumbered it.
Okay, yeah, so I guess my motion would be to let 2020-7 expire, essentially assuming that 2021-1, which would be essentially the same except with an 11 p.m. curfew.
Right. And although I realize now that since 2020-7 extends until February the 4th or whatever, if you want this to take effect before then you need to probably move to go ahead and rescind 2020-7 immediately, and then immediately substitute it for this new one, 2021-1. Does that make sense?
Yes. Okay, so I should make a motion to rescind 2020-7 first.
Well, they could be all done at the same time.
Okay, so basically we would rescind 2020-7 tonight, basically with the passing of 2021-1.
Right, I believe that's the best way to do it.
Okay.
So is everybody clear on that? Pretty clear. Dr. Sousa, you've done a good job of explaining it. Thank you. So we're looking at 2021-1 and rescinding 2020-7 and further discussion on that. We've had a motion and a second on that. Any further discussion?
So back to Dr. Sousa, if you want to, when would you want 2021-1 to go into effect? And when would you want it to, what would be the limitations there?
I guess I would propose if we pass it tonight, it goes into effect now, if that's reasonable. I don't know if that makes any sort of enforcement a nightmare, or if we need to delay it a day or two. And then I guess the same, what did we say, the 18th, which is 2 weeks after the original expiration of 2020-7.
That would be a 2-week interval, 4 and 14.
You all usually give a few days of cushion when you enact something that's more restrictive, to give the public and business owners time to respond to that. I'm not sure it's as necessary when you're easing restrictions.
I'm guessing they would be happy.
But you keep that in mind for the next time you do something, if you ever do something that is more restrictive rather than less.
I guess my question is, why would you not let 2020-7 expire as scheduled on the 4th, and this would take place then and go to the 18th?
I mean, I'm open for discussion on that. I don't know that I have a strong opinion either way.
Thoughts from the board?
It gives people a break sooner.
Well, so
People being business.
okay, so if you want to make this go into effect soon, in the interest of getting things signed and finalized, can we give us a day?
Yep.
I mean, businesses won't learn. I mean, obviously people are probably watching, but if we can let it go into effect, so 2020-7 would terminate tomorrow at 12:01 a.m. Yeah, and this one or at 11:59 or whatever.
That's fine.
Sanders.
Dr. Buchanan and I have worked out a method to get this stuff signed, so we can do that, Martha, tomorrow. I'm around.
Okay, great.
Any other discussion on 2021-1? If not, since we're ready to vote, Kelsey, could you give us a roll call vote on that regulation, please?
Yep, absolutely. I'd be happy to. Dr. Drake,
Dr. Gocher, just, is this one vote to both rescind and pass? Is it one package deal?
I believe that's the way it was brought forth.
Okay. Okay, I'm good with that. I just want to clarify.
Yep. Okay.
all right. Dr. Drake,
Yes,
Go ahead.
Dr. Gocher,
Yes.
Dr. Hurt,
Yes.
Mayor Jacobs,
No.
Miss Roma, Miss Roma,
No.
Dr. Shamia,
Yes.
Dr. Souza,
Yes.
Miss Wagner,
Yes.
Dr. Buchanan.
Yes.
All right, that is 4 yeses and 2 nos. It passes.
Thank you.
You said,
So
I'm
we have
sorry,
adopted-
Dr. Gocher, if I can intervene, is that count, did I understand that count correctly to be 4 yeses and 2 nos?
I'm sorry, I might have said that wrong. It was 7 yeses, 2 nos.
Okay, yes, that's fine. I'm sorry for interrupting, but remember, the board, any action by the board has to pass by a majority of the membership. So 4 yeses to 2 nos would not have gotten it, but 7 yeses to 2 nos does pass the resolution or the regulation.
Thank you, Mr. Sanders. So we have adopted 2021-1. Next item on the agenda is 2020-8, which is the social gathering limitation regulations, which also expires February 4, 2021. Any discussion from the board about 2020-8? And again, I'll start by maybe asking Mayor Jacobs and Dr. Buchanan if they've received any information from their posts in the county, negative, positive, or otherwise, on 2020-8.
I have not. I don't think our office has.
I'll make a motion that we extend it for 2 more weeks until 2/18/2021 at 12:01 a.m.
We have a motion. Is there a second on that motion?
I'll second that.
We have a motion and a second. Discussion on extension of 2020-8 for 2 weeks. Discussions, questions?
I would support that, in that I think obviously this one has less of a, if there is an enforcement piece to either one of these, the one we just talked about or this one, this one does not have that. But I also think the messaging around this one is potentially even, or it's equally important, in that if, even with the state having, the state still has, I believe, a gathering size that's worded a little bit differently than this one. But the message that we would send, because we know how much of this happened in private gatherings, and the message we would send by not continuing this, I would be concerned would be misconstrued as everything is great. They're not concerned to carry on, and we know that this is not being rigidly enforced. At least my sense is that it's not. But I do think it's important, because this is the risk point, is these. Or at least one of the big ones is these gatherings.
You're on mute, Dr. Gocher.
I'm muted. Sorry about that. Any other discussion or comments on extending 2020-8? If there are none from our board, since we're ready to vote, Kelsey, could you do a roll call vote on extending 2020-8 for us, please?
be happy to. Dr. Drake,
Yes.
Dr. Gocher,
Yes?
Dr. Hurt,
Yes.
Mayor Jacobs,
No.
Miss Roma,
Yes.
Dr. Shamia,
Yes.
Dr. Souza,
Yes.
Miss Wagner,
Yes.
Dr. Buchanan.
Yes.
That would be 8 yeses and 1 no. It passes.
Thank you. You have adopted extension of 2020-8. Next item on the agenda, I think Dr. Buchanan is your additional point. So if you would like to go ahead with that.
So thank you, Dr. Gocher, and thank you for allowing me to add this item. I had a PowerPoint. You all have all received the link to the community health assessment in the recent past. We will also have hard copies available for you, if you so desire. So just a little bit about the community health assessment. This is really our cornerstone publication. We evaluate data and produce the community health assessment every 5 years. Public health data, as we know, doesn't change all that quickly, and public health trends aren't rapid response measurements. So when we take our time in doing that. And so this most recent one was compiled for and intended to be published in 2019, but was not published in 2019 because, or early 2020, early 2020, my bad. We did not publish it because we were distracted by other things and busy doing some other stuff. So this report, there really are no surprises in this report. Mental health continues to be a challenge. Obesity, cardiac health, diabetes, substance misuse, all of those continue to be challenges for our community. So we know this is pre-pandemic data, so we anticipate that probably were we to take the same data now, we would see those trends worsening. What will be interesting to see is the impact of 2020 on all of these health trends going forward. Do we see those trends persisting, or do we see some recovery in those trends? And I'm hopeful that we see recovery. One of the things that we did do more in this particular report is we focus more on the drivers of health, those things that influence our health. There you go. So really, in each section, we talk about drivers of health and what are the things that positively or negatively impact our health. And as you can see by this diagram, socioeconomics, physical environment, and health behaviors certainly are things that have a great impact on our health. Healthcare is one of the things that impacts our health, but is not as much of an influence as some of those external factors, such as the environment, education, and income. We also, so what will happen next with this report is that the Community Health Council will take this report and look through it, decide on 3 or 4 areas of health that they will want to recommend to the community that we focus on. And they will create what's called the Community Health Improvement Plan, which will highlight those areas. We'll have implementation steps and strategies and outcome measures. One of the results from our previous CHA and the Community Health Improvement Plan was the focus on substance misuse, and out of that came the All for Knox movement, and that is now specifically doing a strategic plan around substance misuse to help our community address substance misuse together. So that's pretty exciting that, you know, we produced this really great report that has a lot of really good information on our community, and then the Health Council produces the Community Health Improvement Plan, and we're seeing some actionable steps being done as a result. The other thing that happens is we have community partners who use this report in grant seeking, so they rely on it heavily for that. Covenant Health actually uses it as their community needs assessment that that is required of them by Medicare. So it gets a lot of use. It's well done. My staff works really hard to get it out. I'm very proud that we, in spite of the pandemic, were able to finish this and produce it and publish it for our community. So happy to answer any questions if anybody has any.
Dr. Buchanan, I just want to congratulate everybody on that report. It's really comprehensive. You know, I know in times before the pandemic started, these were items that we discussed at our regular board meetings. And this is really comprehensive. So congratulations on that report.
And one of the things that we need to think about is COVID's not gone. COVID's still here. So COVID's still very much part of our health of our community. But, you know, getting back to some of those regular updates and reports that we've done in the past, and it's budget season here in the county. So we'll be bringing our budget to the Board of Health in the near future for approval. So some of those regular things, I was appreciative of a reminder to add it or talk about the health assessment tonight, and was kind of like, oh, we would have probably had a whole session about that. And entertained questions and discussions, and we didn't. So I apologize for that.
Dr. Buchanan, is that kind of procedurally, is that action plan that the group comes up with on the areas to focus, does that make its way back to the board?
It does. It does make its way back to the board. If I remember correctly, I think we've even asked for input from the board at times on some of the things that are being considered, or but yes, it does make its way back to the board, and is made available for anybody in the community to look at and use, and use for the organization, use for purposes of grant writing, policy setting.
Dr. Buchanan, that was great work. It was very informative and everything put together and easy to understand in an impactful manner. Anyone that hasn't looked at it thus far, I think for me, the biggest point was, in addition to the other issues, was really mental health and the issues that we're facing there. So as Dr. Gocher said, congratulations to your team. They did a great job.
Thank you.
Any other business to come before the board this evening? We're in other business right now. Anything else that we needed to go over? If not, we'll accept a motion to adjourn, and we will see everybody in about 2 weeks on the 10th of February. So appreciate everybody's help this evening, and have a good rest of the evening. Thank you.
Motion to adjourn.
I second it.
Right.
Very, very quick, Dr. Shamil. You saved me. All right. Thanks, everybody. Good night.
Thank you.